Welcome to the ICAHN Institute for Board Education. I'm Pat Scow, the Executive Director of the Illinois Critical Access Hospital Network. I'm pleased to introduce to you Bob Thorn, who is the Director for Pinnacle Consulting. Bob has years of healthcare consulting experience as well as operational as the CEO of a hospital. And he has also served as interim CEOs for rural hospitals, so knows very well the role and responsibility of rural hospital CEOs, as well as the roles of board members, having worked with many boards over the years. Today he's going to talk about board education and the role that you need to have as far as your duties and responsibilities, all the day-to-day type of stuff, your role as a policy director, and how you oversee and not oversee operations of the board. He will talk about strategic planning as well as the CEO relationship and how we work together as a team to do the very best for our community. So thank you, Bob, for joining us today.
Hi, I'm Robert Thorn from Pinnacle Healthcare Consulting. It's my pleasure today to discuss some key points regarding the age-old debate between a district or nonprofit hospital board's roles related to its authority and hospital administration's responsibilities for operational management. It's a fine line that is often blurred, even with the best of intentions. However, through education and practice, the line can be seen clearly from all sides and respected. I like to think of the board-management relationship as an hourglass. On one side, you have sand, which represents information flowing through a narrow bridge and landing on the other side. The narrow bridge represents the CEO. In most cases, where there is a lot of transparency, each side can see and know information is flowing through the bridge of the hourglass. Whether it is going from the board to the organization or from the organization to the board, the CEO is the point through which information passes. To do otherwise has the potential to usurp the CEO and bring the board into a management role. In a perfect world, information is constantly flowing from one side to the other, and in which direction depends on the circumstances. Now that we have a visual of how information flows, let's talk about the management of this flowing information and how a board's roles and responsibilities compare to that of administration. This should help us to keep duties clearly separated and distinct from one another. Overall, there are 5 general areas with which a board shall concern itself. These are strategic planning, CEO selection, performance, and succession planning, financial oversight, oversight of quality, safety, and performance measurement, and lastly, governance. Board duties, including governance, require oversight of the hospital's well-being and the intentions of its decisions and actions. There are other duties, such as regularly attending meetings, board committee participation, and advocacy, which also fall under a board member's roles. However, the purpose of today is to outline general guidelines regarding the division of roles between a hospital board and the management of the organization. You may have noticed I mentioned a few key words more than once, including oversight, performance, and planning. These words represent a high-level role compared to the responsibilities of management, which are in the thick of things on a daily basis. As the representatives of the owners of the organization, be they the taxpayers of a special district or county or a community at large, the board is the accountable party to its constituents, its patients, the state government, including its attorney general, and ultimately the federal government for the operation of a hospital. Therefore, oversight, performance, and planning are essential and appropriate for a board. In looking at a board's roles and responsibilities, let's start with strategic planning. The board is the party that ultimately owns the organization's strategic plan. While the CEO is responsible for resourcing it and executing it, the board owns the plan for a number of reasons. The strategic plan is greater than any one person. It is designed to evolve and withstand the test of time and even multiple boards and leaders. CEOs may come and go, board members may join and lead boards, but the strategic plan is the common thread that keeps the organization on course throughout these changes. Assuming the plan is properly funded and resourced, administration's performance key metrics should be regularly reviewed, scrutinized, and questioned as appropriate by the board so that progress can be monitored. However, it's not the board's job to carry out a strategic plan unless there are specific goals directed toward board activity. Everything else should be operational and therefore fall under the management responsibility of the CEO. In essence, the strategic plan is the game plan by which the CEO leads the organization. As the board has responsibilities for the selection, performance, and succession planning of the CEO, It needs key tools in order to manage these responsibilities effectively, starting with the CEO's job description. There are a number of factors to consider, such as experience, training, clinical versus non-clinical background, and references, among many others. It's critical to have the job description reflect these desired attributes and the specific duties the CEO will perform. And that's just to get the right person into the role. Once in a role, reviewing the performance of that person ensures to the board that progress is being made, identifies where challenges may occur, and that information is flowing. A monthly check-in, usually a private meeting between the CEO and the board chair, helps to ensure that there are no surprises. If a CEO needs improvement in an area, direction must be given by the board and expectations agreed upon, with planned timelines for measured improvements. This structure provides the board with the same expectation for the CEO that the CEO has for every employee of the organization. And then there's succession planning, where board and CEO collaborate on what to do if something happens to the CEO. If a CEO wants to leave, or if a board wants a CEO to leave, it's best to have a plan in place ahead of time rather than to wing it. Unfortunately, only about half the hospitals in this country have a succession plan, which can make a bad situation worse and is where the line may be blurred by having a board member assume some of the duties of the departing CEO. A succession plan will help prevent this by identifying how personnel can be deployed during a leadership transition. The next board responsibility, financial oversight, is often manifested through the board's approval of operating and capital budgets, budget variance requests, and financial performance. A lot of attention is given to financial performance, and rightfully so. Financial performance is often the most visible of all measurements of a hospital. However, like board's other responsibilities, effective financial oversight depends heavily on effective and timely communication from administration, which allows decisions to be made in proper context. It requires administration to bring the board well-thought-out recommendations upon which to make financial decisions. Such transparency ensures administration is operating as directed by the board while receiving proper board support. Board-approved policies help to provide guidance and direction from the board to administration of performance of their duties. Like the goals of a strategic plan for an organization, it is the board's responsibility to oversee quality and safety measurements and performance. And like any strategic goal, performance should be monitored regularly. Monthly board meetings are the perfect venue for this public disclosure. As with any other goals, if quality and safety goals are not being met, it is the board's responsibility to expect plans for improvement by administration. Most importantly, though, as stewards of a community asset, a board's governance goes well beyond the oversight of administration's performance on operational matters. For hospital governing boards, fiduciary responsibilities and their underlying need for accountability and trust can be complex. Boards have a responsibility to act in the best interest of both the hospital and the communities their hospital serves. This is often confused with financial accountability. Rather, as fiduciaries, board members must be as well informed as reasonably possible before making any business decisions. They must always put the needs of the organization first when taking responsibility for its operations, and they must abide by all laws, regulations, and standards under which hospitals operate. These three main fiduciary responsibilities are commonly referred to as the duty of care, the duty of loyalty, and the duty of obedience. And each may be applied legally to determine whether or not a board member has acted appropriately. While what I've described may seem like a lot of responsibilities, nowhere did I mention taking on additional responsibilities for addressing day-to-day activities of administration. Rather, the role of the board is to provide structure, guidance, and checks and balances. Administration's role is to allocate and manage resources in order to effectively execute strategies and tactics to meet goals and to regularly report on progress or challenges of such efforts to the board in a timely and constructive manner. In terms of both function and effectiveness, the best tool for a board is education. As laws and regulations change and standards of care change, education is the best insurance for a board and administration to stay effective in their respective roles and responsibilities, so that the hourglass is working well and information is flowing freely through the CEO to the other side.